Well, good afternoon, everyone, and welcome. Thank you for joining us on this Thursday for our end-of-the-week press briefing. Today, Mayor Demings will discuss our COVID-19 numbers and our positivity rates. He will give an update on CARES funding for individuals and families and report on the important work of our strike teams and what is taking place with the eviction diversion program. The mayor will also have a special award for a special person who's gone above and beyond to help keep our citizens safe. From the Florida Department of Health in Orange County, Dr. Raul Pino is here with, of course, important information and data on our COVID-19 trending here in Orange County. We begin the press event with Mayor Demings. Mayor?
Thank you, Dr. Williamson. I have to recognize our staff. Dr. Williamson does a good job. We have now had, I think this is the 82nd press conference that we've done since we have been wrestling with the pandemic in our community, so I want to acknowledge him today. But other than the COVID-19 pandemic, what's on everybody's mind? What are they talking about these days? Voting, right? Voting, and so we're just only 5 days away from the election day on November the 3rd, and here in Orange County we have approximately 870,000 people or so who are registered voters, and I'm told that about 430,000 people have already voted. So nearly half of our registered voters have already voted. So that's what it's all about, is getting out and exercising that right that we all have. And so to our residents who have not voted, we know that you will vote. And I want to accentuate some high school students here. If you're a high school student and I think you're within 6 months or so of a general election, you're able to register to vote. And this week, some students from my alma mater, Jones High School, went to vote. They were supported by Elevate Orlando. And I believe we have a picture behind me of them going to vote at the Amway Center. So we do encourage all of our young people to get involved in the political processes and be active in their communities as well. So I wanted to acknowledge them. We're going to come back and do another acknowledgement, as Dr. Williamson pointed out, of another youth in our community who's out doing the right things. Sometimes we focus on the youth who are involved in the wrong things, and today I want to talk about those who do the right things. But we are going to move forward and talk now about the pandemic. We have now just under 46,000 cases in Orange County. 45,941 cases is what I have at this point. That's an increase of 200 cases since yesterday. So that really means that even though the numbers are relatively low most recently, we still can't let up from what we are doing and the focus that we have on reducing the spread of the virus in our community. Dr. Pino is going to talk about the numbers. I'm going to let him get into all of that today and the positivity rates. But I do also want to acknowledge our Orange County Health Services. They have been providing free drive-through testing for months now. Just this week, a total of 680 residents were tested at Barnett Park at that location. That really indicates that the demand for testing remains high within our community. The team will continue to offer free testing next week at Barnett Park as well on Wednesday and Thursday. That's November the 4th and November the 3rd, Wednesday and Thursday of next week between the hours of 8 a.m. and 1 p.m. You can make an appointment by going to ocfl.net/testing and click on number 1 on the testing map, and you can be assured of being tested. The results at that site are available within about a 48-hour period of time. Rapid antigen testing is now also available by the state at the Orange County Convention Center. Yesterday, the Convention Center provided a record 1,000 tests in that one day. The highest number of tests provided since the Convention Center began offering rapid testing. We also continue to allocate local CARES Act dollars to get money into the hands of our residents who need it most. We so far have assisted over 35,000 of our residents with our $1,000 grants. That equates to over $35 million that we have provided to individuals and families in this community. However, we know that there really are more residents who are in need, and we know that there are many households that have been impacted financially by the virus itself, and funding is still available to assist those families. I want to give you an example. A couple of days ago, I had the opportunity to talk to a young lady who approached me, and she was concerned that she was facing eviction next month, and she was looking for some resources and did not understand that she was eligible to apply for our eviction diversion program. She thought she was ineligible because she is currently working, but her hours had been reduced, so she thought that you needed to be unemployed in order to qualify for the eviction diversion program. So I want to clear that up. If your hours have been impacted or reduced in any way, you can qualify if you're facing eviction. We have dollars remaining to allocate to our residents. Our eviction diversion program has roughly $11.7 million in CARES Act monies available to help landlords and tenants before the December 30th deadline that we have to expend the funds. I also want to announce that our next application portal opening for CARES Act funds provided to families and individuals will be on Wednesday, November the 4th at 8 a.m. We will open our portal up to an additional 15,000 users. So that's the day after Election Day, 8 a.m. We will reopen our portal for individuals and families who may apply for the $1,000 grants. Over 1,038 families, 1,038 families have taken advantage of our eviction diversion program, and that equates to about $3.2 million that has been paid out through the Comptroller's office to cover rent payments. Orange County staff continues to work tirelessly to get these dollars in the hands of landlords. Just this week alone, they are paying out $200,000 each day to assist cash-strapped tenants. I'm going to give you an update on our strike teams, our compliance teams. They have been in operation for 75 days. They have inspected nearly 4,100 Orange County businesses so far with a first-time compliance rate of 87%. The teams have visited 5 businesses a total of 5 times. You know, out of the 4,100, 5 businesses had to be visited 5 times, and 4 of those businesses still remain on the list. Marathon Gas Station at 5365 International Drive, the Windermere Flowers and Gift Shop at 5008 Dr. Phillips Boulevard, the Italian Garden Pizzeria at 12,779 West Colonial Drive in Winter Garden, and the Iron Religion Gym at 5247 International Drive. I'm happy to say that that means that the overwhelming majority of businesses have cooperated with us, and we do appreciate that cooperation. Now I want to transition to a special award. As I said, we have been providing free testing for months, and I want to recognize one of our young volunteers. I'm going to ask Mr. Cesar Londono James to come up at this time, and I'm going to share a little bit with you about him. He has been volunteering at our Orange County Health Services sites for months. He has volunteered over 400 hours. If he was working full-time, 40 hours a week, That means that he would have worked for free for 10 weeks at our testing sites. During that period of time, he has put together over 12,000 packets of personal protective equipment to hand out to residents who have been tested. These PPE kits include face masks and hand sanitizer and have been important part of the important information that we are providing to our citizens. He has been helping to keep our community safe by providing the needed information and test kits. So Cesar is pursuing a medical engineering degree. He intends to continue his study after leaving Valencia. He is joined here today by two special people in his life. His aunt, Daniela Sullivan. She happens to be our health services administrator in Orange County Health Services, and she is joining him today. And his grandmother, Miss Marianela Rodriguez, who he passionately calls Avida. They are here, so if you all was just stand and wave your hands, I'm going to present an award to Cesar at this time. Congratulations, thank you for everything that you've done. I will put him on the spot and ask him to give a short speech, but I'm not going to do that to him at this time. But we do appreciate his work in this community, and I know that the future is bright. Again, we wanted to accentuate the positive things that our young people are doing here within our community. And our Public Safety Director, Danny Banks, and Health Services Manager, Yolanda Martinez, are also here today. We will take a picture with Cesar immediately afterwards. So again, thank you, sir, for being here. I'm going to turn it over to Dr. Pino at this time.
Good afternoon, Mayor. Good afternoon, everyone. Thanks for being here. We have a little bit of data to provide you with, so bear with me. It's going to be data heavy today. But these are, before I go into the specifics of today, this is our hospitalization data for the last, up to the 24th of October. The Sentinel requested this graph earlier this week. And as you see, our hospitalization has decreased. And now it's kind of stable. As the 24, we have 148 individuals in our county hospitalized for COVID-19 or a COVID-19 diagnosis. If you look in the 18th of July, we have 604 in the same category. For intensive care, on the 24th, we have 47 individuals. On the same line item on July 18th, we have 104 individuals. So as the 24, our systems continue to do well, and they are not, to the best of our knowledge, overwhelmed in any way possible. As well as the ER visits, the graph is not there, but the ER visits have also declined for COVID-19 flu symptoms, but increased a little bit, for COVID has decreased, just increased a little bit for flu-like. Next graph. This one is looking at, is overlapping COVID fatalities with daily cases. And what is the correlation? And we always have mentioned to you that the death data runs a little bit behind the incidence data, meaning new cases. And what you have seen there in the blue bars are the new cases, and in orange, you see the number of deaths that correspond to that day. This is the day that the death was reported to us. Next graph. In this one, we are looking at fatalities too, but now the differentiation is those fatalities that happened outside long-term care facilities and those in long-term care facility. In orange, you have death that has happened on residents of assisting long-term care facilities. And this is an important data for us to follow, as we have mentioned to you how concerns we always are with the virus jumping into assisted living facilities, with most of the residents are over 65, most of the residents have pre-existing conditions, and they are, in a space that is not that large. Next. This one is on the bottom, you have the weekly number of cases. In week 42 and week 43, this is week 44. So that decrease that you see of 55 doesn't count, but it's generated automatically. And we only are in the second day of the week. So that's why it's showing 55. But if you can see in the 2 prior weeks, we are very stable. We only have a 1% growth within those weeks. And that's an indication also that our numbers are changing. And I'm going to explain a little bit about that. On the top, you have our epi curve based on symptoms, the day of individual develop symptoms, and it's also stable. Next. In this case, these are cases by day. The 3 days, our rolling average is on red, but the one that is always interesting is the black line. The black line is all the data has been analyzed and is smooth so that we can better see what the trajectory is. With graph and lines, you can get dizzy looking at, okay, what is really happening or not happening here. But the third line, the straight line, it gives you an idea and it smooths the data. And if you can see, it's very slow, but it's a progression on the to the upper in our data. Next. This is fatality rates by age and we knew this. We know that people over 65 years old are more likely to have a negative result, a poor health outcome result with this disease, and the older you are, the riskier becomes, and the more likely is that you could have a negative outcome in your health. Next. Oh, okay. Now, in this data, we excluded the dump that we have on August 31st. So in here, by the week, you see the incidence per 100,000 cases. Now, the difference is not much between week 43, we just finished, and week 41. But if you look at week 40, at week 39, so you can start seeing some inclination going in the upper direction. Next. And this one is the one that we follow the most. This is positivity rate, 14-day average. It does not include any testing that was done, and I don't think that we have any left, probably little, at the bubble at Disney. This is just pure Orange County residents. And although the data continue to be very stable, the alert here is that positivity rate is a correlation between the number of tests that are done and the number of tests that return positive. The more testing you do, the more likely is that you will find positive cases, but also the more likely is that you will find some negative cases. So we are doing a lot of testing, and our data positivity rate continue to do the same, but our testing has increased in the last few days, but also our number of positive cases. Next. So this is in the last 14 days for the blue, accumulative for the orange. The orange is the number of deaths, the blue is new cases. And this is what we have been explaining to you, is that in this case, 51 of all cases are between 15 and 34 in the last 2 weeks. 51 of all our cases are between 15 to 34 years old. Next. And this is looking at pediatric cases, 18 and younger, in the last 14 days, the bottom and top accumulative. So that we know during the entire duration of the pandemic, 18 years and younger, we had 3,430 individuals. and in the last 2 weeks, 251, and those are the age groups of which those cases are. Next. And this is for 15 to 17 years old positivity rate per 100,000. And you can see the opening up at the end of the curve that correlates with the last 14 days and the increase of more than 50% of all cases in this age group, in that age group. So it's a clear indication the data is matching, that our numbers are increasing slowly, although our positivity rate hasn't changed, and the highest increase in proportion happens between people of the age 15 to 34. Next. This is the same, but just daily graph, number of cases and the average. Next. And that's it for the entire duration of the pandemic, so that you can have that data that was requested by the media, but probably our residents will find very informative. With regard to today, our positivity rate continued to be 95%. The number of deaths, although the data is reflecting 559, tomorrow morning it will be 565. So we got that data after the publication. So we want to give you the entire of the data, as we will not see you until Monday. So a total of 19 deaths have been reported since we talked to you last. Age 54 to 92, 5 female, 14 male, 1 Asian, 5 black, 3 other, 7 Hispanics, 11 non-Hispanic, and 1 of unknown ethnicity. 16 had pre-existing conditions, 3 we didn't know, and of course, our thoughts, prayers with the families and friends. 9 of the 19 deaths that reported to us happened in assisted and long-term care facilities. For yesterday, we received, and the mayor mentioned this to you, 200 new cases were reported to the state with a median age of 37, and the positive rate for yesterday was 3.7 with a 5,772 case negative test. I would like to encourage everyone to please vaccinate against the flu. We are having a flu pod-free vaccines on Saturday, November 7 at Jones High School on 801 Rio Grande, close here in downtown. That's the information that I have for you. We'll answer any question that you have. Mayor?
Okay, thank you, Dr. Pino. I think he was pretty comprehensive in a review of the data, so it tells you precisely where we are at this time. We'll open it up to any questions. I do want to point out that we do have Mr. Scott Howard here from the Orange County Public Schools if there are any school-related questions as well. And with that, we'll open it up for any questions. So I know we have Ms. Lauren Seabrook here, and she usually has a question for Dr. Pino right from the very beginning. So there you go, Dr. Pino.
Thanks, Mayor. Lauren Seabrook, Channel 9. Dr. Pino, we're seeing around the country cases start to rise again, and I think even on a state level, we're seeing more so than here in Orange County. Do you think, is there a reason that maybe Florida's doing better than some of the other states right now? Does it have anything to do with this being warmer here? What are your thoughts on that?
I don't know. It looks like when someone else is bad, we are good, and when someone else is good, we're bad. So I think it's a cyclical piece of the pandemic, in the sense that it may have to do more with fatigue, and you get tired of doing what you need to do, and then we relax, and then it comes back. And the question with this virus, as I mentioned before, is how fast is the spread. Is in a couple of weeks, you have thousands of cases if you are not taking. I think that part of the issue where Orange has been better is that our community has responded very positively to the measures that have been put in place. And respecting the mask mandate has been a critical piece of this. Also, the county has engaged in millions of dollars in PPE distribution for free to businesses and other entities, as well as the state, and I think that has helped. We also been very aggressive with quarantine and isolation with the school system with the help of the school administration. And so I think all these factors are playing in it. And you saw we have a very comprehensive operation for tracking and investigation that I think is playing an important role in containment.
Kelsey Thord with West 2 News. My question is for Dr. Pino, but it's probably also for the mayor as well. You talked about how we're still seeing a good amount of our cases in the younger people. Are you at all worried about Halloween weekend? You know, that tends to be a lot more younger people that participate in that. Do you think that we could see issues with that, maybe at the bars or even just younger kids trick-or-treating, that kind of thing?
So, you know, any event, any holiday, any large number of people concentrating and gathering is a concern for this disease. And Halloween will not be different. So we are alerting people that we can celebrate, we can have fun, and at the same time, we can protect ourselves. We have just to be careful, be mindful, and protect others and ourselves.
What tips do you have for people to do that?
Well, the first tip is the mask. And when you are not alone, no matter what age you are, and if you can wear a mask, you should wear a mask. Washing your hands is critical important. And when interacting with other people, even if you know these people, you should be careful. The largest outbreaks that we have been of people that know each other, that welcome someone because I know you, I assume you're fine, you are not exhibiting any symptoms, you are okay, come. And then I relax, and then we all get it. And that's part of you have to be alert. You have to assume that everyone has the virus if you want to protect everyone.
I think the only thing that I would add to that is while those who are participating in the various Halloween activities have the responsibility to mask up and protect themselves, those who are going to be putting together the candy and other items that will be given away, they have a responsibility to, I think, be very safe in how they prepare those packets. They should be wearing a mask, wearing gloves, etc. And we have suggested that rather than just put a barrel of candy out and for all the kids to go into the same barrel or for an individual to give candy directly to children, that they pre-package it so that the kids can reduce the likelihood that they will touch items, multiple items at multiple times. So I think that it's important. What I'm saying to you is that the person who is preparing the items need to be safe in what they're doing, and then those who are receiving it also need to prepare themselves. Okay. Other questions? There we are, Steve.
Steve Hudak from the Sentinel. Sorry about that. This is for Dr. Pino. Dr. Pino, just to recap some of the numbers you showed us. In general, things are trending upward a little bit, but we're still in a manageable situation, right?
Correct.
Okay. I was curious about this because UCF reported 177 positive cases during the week ending October 24th. That includes 67 students who tested positive on campus and 110 who tested positive elsewhere and self-reported it. Do you have concerns about what's going on there or concerns about any outbreaks any other places right now?
So,
I mean, given the idea that UCF has, I'm trying to use the right vernacular, a lot of kids, a lot of students.
yeah, listen, 100 cases or so in a large population like the student population at UCF lacks significance statistically speaking. In their cases, of course, most of them will perform very well, and most of them may be even asymptomatic. But The issue with this younger population being infected is what we carry home us with. And what when we interact with people who are 65, who have pre-existing condition, what happened? And the invincibles, as they are called, that age group, should be mindful also that not everyone else is invincible. That there are plenty of people who are very susceptible to this disease. Regarding to the questions about outbreaks, there are few that we have talked about it. You know, outbreaks, we don't close it. They are open for 2 weeks from the last case that is reported. So every time that a new case is reported in an outbreak, even if it's isolated, the county restart again, so that we have the ability to monitor anyone within the 2 weeks infectious period that may become positive. The schools in general, which is always a concern, are doing very well. We have cases like expected, but our ability to work with the school system, with the population in general, communicate, isolate, and quarantine quick, has given us good results. So I think that's where we are. I think you put it very well. Our data is inching a little bit up, but not too alarming. And the positive rate continue to be acceptable.
So my question would be for our Spanish viewers, and please, Ilya, with the translation. This one's for the mayor. As my colleague mentioned, the Halloween celebrations are coming, and one of the major concerns is the parties and the activities downtown. I would have wished that Mayor Buddy Dye was here, but I wanted to ask Mr. Demings, are there any special preparations in terms of supervision, surveillance of businesses prior or during the Halloween celebrations? From previous years' experience, there's going to be a lot of people downtown celebrating and probably, partying. And so.
Okay, thank you for the question. We have tried to be proactive in our approach to gaining compliance from businesses, inclusive of bars.
Nuestro acercamiento a esta preocupación ha sido ser proactivos para ganar el cumplimiento de las empresas, incluyendo los bares.
Our compliance teams have been dispatched throughout the community, and they're there to be helpful, to help remind businesses of the various CDC guidelines, and they're going to continue to be out even through the weekend.
Hemos despachado los equipos de cumplimiento a las diferentes áreas para recordarle a los dueños de negocios sobre las diferentes directrices emitidas por el CDC, etc.
Mayor Dyer reported at the last briefing that they're using their downtown ambassadors to go to the businesses, the bars in downtown in advance and share best practices with them.
En la pasada conferencia de prensa, el alcalde Dyer reportó que la alcaldía de la ciudad de Orlando está utilizando embajadores para visitar los bares que se encuentran en el área de downtown para compartir con ellos las mejores prácticas.
So we not only want the bar owners and managers to be responsible, but we also want the patrons to be responsible. And if you see where you're in a crowded area and people aren't wearing masks and that's of concern to you, you should simply leave and not patronize those businesses.
Queremos que los dueños de las barras y los gerentes sean responsables, pero también queremos que los ciudadanos sean responsables. Así que la exhortación del alcalde es que si usted entra a un establecimiento y ve que no se está haciendo el uso de máscara, no se está obligando a los clientes a hacerlo, que por favor no patrocinen el local.
We have endeavored to provide personal protective equipment as well as hand sanitizer to businesses that have reached out to us, inclusive of those locations within our municipalities.
Hemos distribuido equipo de protección personal y desinfectante de manos a todos aquellos negocios que nos han hecho el acercamiento.
And I believe that by providing the PPE, we have created the opportunity for them to be able to assist their patrons and employees in being safe in those environments.
Entendemos que con la distribución de este equipo de protección personal hemos creado para los negocios la oportunidad de que puedan dar un ambiente seguro a sus clientes.
Okay, thank you.
This next question was texted in for you, Mayor Demings, from Danielle Lama with Fox 35. A recent poll showed 3/4 of Americans are worried there will be violence on Election Day. Have they been in contact with, or have you been in contact with law enforcement regarding preparations to prevent this from happening?
I do receive some briefings from law enforcement, and they are doing what they can to monitor social media and other threatening correspondences that are within our community. And to date, there's no indication that we should have any violence around our polling places.
This next question is for you, Dr. Pino, from Eric Mock with News 13. His question reads, Dr. Pino, with no masks required at Trump rallies, do you think these events contribute to the spread of COVID-19?
I have the same knowledge that everyone has from the news and what happened in other states. I don't have any knowledge of any linkage to any of the political rallies that had happened in our county.
This next one is from Mike Schneider with the AP for you, Dr. Pino, as well. Dr. Pino, have you heard of anything about the state of Florida planning to stop funding local efforts to trace new coronavirus infections after November 30th? If yes, what more can you tell us? How will this impact efforts in Orange County?
So I don't know the answer to that. The money that we are using for those efforts, it came from the CARES Act money, and that money is set to expire December 31st by Congress. I don't know if that will be extended or limited or earlier. So far, we have not received any indication. We have adjusted our personnel depending on the volume of the work that we have to do. And right now, we are at the right levels.
And Dr. Pino, this one is for you and probably Scott Howitt with OCPS. This question comes from Sierra Putman with WFTV. Her question reads, how many positive cases were connected to Bishop Moore's football team, and did that impact non-athletes learning face-to-face?
I don't know.
So I will point out that Bishop Moore, that's not a public school, so Mr. Howard is a representative from the Orange County Public School, so he wouldn't have information on Bishop Moore. And if Dr. Pino doesn't have it,
Well, I have access to the information. I don't have it in my head.
Her follow-up dealing with OCPS report cards were, report cards are out. Is the district dealing with another COVID slide, convening student grades, and how significant is that issue?
So we'll ask Mr. Howard to come forward.
You can keep it.
Thank you for the question. I think the concern was as a result of the end of the 9 weeks and the report cards that came out, the number of, or increased number of Ds and Fs was a concern. And so what we've done is worked with our families and asked our families that if they're concerned about their children learning at home, to speak with their schools and see if we can get them back into a face-to-face setting where they can be more productive. Or are there other resources we can provide for the parents at home that will help them get their grades up before the end of the semester? So that's really the concern. We just want to be there for our families and make sure that we're working with them at the school level.
Thank you. Just two more. Troy Campbell with WKMG. This question is for Mayor Demings, and I think maybe some folks that are here with the CARES Individual and Family Assistance Program. The question reads, as of today, how many $1,000 payments through the Orange County CARES Act Individual and Family Assistance Program has been issued? Also, what's the average wait time between an approved application and an issued check?
I'm going to ask Diane Arnold. She's been managing that process. She knows these numbers, and so I'll let her respond to that. Thanks.
Good afternoon. For the first part of the question, we have sent to the Comptroller's office for payment approximately $35 million, as the mayor mentioned earlier, which is 35,000 payments. Checks have already been issued for and mailed out for approximately $31 million, and the other $4 million is already in process. In terms of wait time, which I believe was the other part of the question, it depends on the individual application. Our processing since October, we've been able to approve and get out payments within less than a month. It kind of depends if the application, there's an issue with it or not. We get a lot of applications. Just to give you an example, that for, the address doesn't automatically verify in the system, means we have to then do a manual process, since one of the requirements is to be an Orange County resident. But in general, our goal is to get payments out within a month.
Thank you. And this last question comes in from Ryan Lynch with the Orlando Business Journal for you, Mayor Demings. With the county's CARE Act funds needing to be spent in full by December 30th, what approach is the county taking when it comes to the potential need for business and individual financial support in 2021?
Well, we're going to continue our lobbying efforts at the federal and the state level. I am fairly confident that there will be a second round of some type of stimulus assistance for small businesses and perhaps individuals as well. So obviously we're in a hold pattern until after the election next week, and I'm reasonably confident that Congress will reconvene and address that. There is not enough local dollars available to be able to meet the true need of the entire community itself. But as a county, we will continue to use our budget to the extent that we can to provide assistance, crisis assistance that we would normally be providing. But the capacity, the need in our community exceeds our traditional budget. Okay. It appears that that is the last question, at least for the general group. If you have individual questions for one-on-one, I'm sure Dr. Pino will be here, and Mr. Howard will stay around as well. Thank you all for being here. We hope everyone has a good, safe Halloween weekend.